was diagnosed with breast cancer in 2012. I had a mastectomy to remove the cancer, and they had to also remove my lymph nodes as the cancer was there as well. Almost immediately, within a few months, my arm started to swell and I found the lymphedema really started to affect my life. I've got 2 small children. I found simple things like joining in playing games, water, bath times, silly little things really, but wearing a compression garment, it gets in the way, it's sore, it's painful, it can cause my arm to ache a lot.
So the problem with lymphedema is a problem with the lymphatic vessels and the transport of the body tissues back up to the veins, the major veins. So we're trying to relieve all the fluid that builds up. And in lymphedema, there's a dysfunctional abnormality in that flow of lymphatic fluid back to the veins. So what we're proposing is a treatment for that which bypasses the abnormal lymphatic vessels and shifts all that fluid into the veins instead on the limb. So it's a rerouting procedure essentially. It's performed under local anaesthetic on the whole, although there are a few exceptions to that. The patients are done as day cases. It takes about 4 hours. When I see them in the afternoon, they're primed and prepared and consented, and they get to theatre. And in theatre we make them as comfortable as possible, pillows under the legs, music playing. They have 3 to 4 incisions on their arm or their leg, and the surgery is then performed with microscope control. After surgery, there's some small stitches put into the wounds, a small bandage over the wounds, and they're discharged home within an hour of the surgery finishing.
I had the procedure done on my arm a week ago at Neath Hospital. It involved 3 incisions in my arm. So far so good. I've been relatively pain-free. I'm on antibiotics now for a week just to make sure that I don't get any infection in there. But so far it's really feeling great. I'm hoping that in time it'll mean I don't have to wear my sleeve and get back to normal. Who knows, maybe even go back to dental nursing in the future.
Now, in the very early days of undertaking this surgery, but what we would hope to see is in 50 to 75% of patients, they can either reduce the amount of time they need to wear their garment or remove their garment altogether. In up to 80% of patients, we'd hope that they no longer had any episodes of infection, which is the main thing. The reduced swelling, we should hope that up to 40-50% of the swelling will go, and this in itself would be a major advantage in terms of their clothing and their comfort with that arm or that leg.